Good evening, everyone, and welcome to Unfinished Business. I am Rogette Harris, and I look forward to having conversations with you every week. It's hard to differentiate between fact and fiction in today's culture and political landscape. Every week, this show will take a journey through the news of the day and current events. Tonight, we have a very special guest, Dr. Eric Feigl-Ding, who is a scientist that specializes in studying infectious diseases. Dr. Ding has been offering his expertise nationally and internationally on the coronavirus pandemic, known as COVID 19, that is plaguing the world. Everyone has been affected by the coronavirus, either health wise, economically, or both. I myself know people who have lost their jobs or who have contracted this horrible virus, and unfortunately, not all were able to recover. This virus has also highlighted yet again the inequities that continue to exist between racial groups in the United States regarding access to quality health care, testing, treatment, and even job security. And where is the leadership at the federal level? Why is the Trump administration withdrawing funding for testing sites, trying to end healthcare for millions of Americans during this pandemic, and not encouraging everyone to wear a mask when out in public, let alone not wear a mask themselves? These are just a few of the topics we will take on during today's show. Please subscribe to watch our weekly show on YouTube at Rogette Harris. And also, feel free to send a comment, show idea, or just say hi at unfinishedbusiness@rogette.com. Let's get busy and solve some unfinished business. Hello, and thank you for joining us again. With me now, I have Dr. Eric Ding. He is an epidemiologist along with a senior fellow with the Federation of American Scientists. How are you, Eric?
I'm good.
Good. Haven't seen you for a while.
I know. Been a little busy.
Yes. So give us a little bit about your background. In some ways, you can kind of be seen as a whistleblower. You were one of the early people who kind of saw this virus could turn into the pandemic it turned out. How did you see that when other people did not?
Well, I think there were many other epidemiologists and virologists who saw the dangers, but I think oftentimes many of them are very hesitant to speak out loudly before all the evidence is in. Because oftentimes people are very, gun shy. They don't want to speak before they're sure. But then the nature of this epidemic is if you want to wait until you are absolutely sure you're right about something, you're always going to lose to this virus, right? And we know from many other epidemics, moving slow is literally deadly. So I decided, you know what, I have less to lose in life than some other people, and if I spoke out versus some other news pundit who spoke out, it makes a big difference. And all I wanted to do was get people's attention because back in January, no one was paying attention, and so I went for it.
So how do you kind of see the current atmosphere? As you know, the states are starting to open up. People are getting back to work. The president is going back to his big rallies. I hear baseball season. They're going to try to start. Movie theaters are going to be opening up. How do you see things? Because as you know, cases are starting to rise in certain states.
Yeah, the trajectory right now is really bad. We've set a brand new record high. 2 days in a row, but not just that, but our 7-day average has now surpassed the previous 7-day average peaks back in April. And it's kind of very sad. We've lost all the gains, all these shutdowns and everything. We've lost all the gains. We've basically forfeited them all, because we did not shut down tightly enough. We kind of gave up, and we're now paying the price. And in terms of where it's going, I don't know, because there's not enough political willpower to do another massive shutdown. Right now, they've just paused the reopening phases, but that's not the same as shutting back down. and I'm not sure. They might have to do another stimulus package, and people
Some
have
people didn't get the first one.
shutdown fatigue.
We're still waiting for some people to get the
I
first
know many
stimulus
people
check.
still haven't gotten it. It's really sad. And the PPPs are oftentimes been the PPP loans to employers. Not all of them got it, and the other problem is now the PPP loan period is running out soon, and so everyone who's been just kind of barely hanging by because of PPP assistance may be seeing massive layoffs in the near future. So, and we're just terrible at wearing masks. Our American rugged
Right.
individualism is great in some ways, but when you're trying to settle a frontier, but in certain ways it's terrible when you're trying to get everyone to comply. Just wear your mask, especially since if 95% of people wear it, we don't have to do shutdown, but we're not there.
But do you think part of it is because we see the president himself not wearing a mask and the vice
Absolutely.
president and some
I
of our
think
elected officials?
it's terrible leadership, you know, because there's we know it works. It's it reduces transmission by 70% at least, and but yet our leaders, when they go to states and factories, they don't wear masks. They come to the headquarters, where, by the way, in Arlington, Virginia, where Trump Pence headquarters is, there's actually workplace laws that actually says you must wear a mask, um, but they still didn't, and it's extremely frustrating because leading by example is really key. And of course, if Trump and Pence don't wear masks, the rest of their followers don't wear either. And so it's very upsetting that mask is now a symbol of being anti-Trump or pro-Trump.
Right. I kind of see three groups. You have the group of individuals because they are sick with other illnesses, they're scared to even go outside the front door. And then you have the group that thinks they're invincible, that this virus isn't as serious as what it is. So they're out laying on the beach, just going out to restaurants, doing whatever they want. And then you have that protest group that has turned this completely political. So if you wear a mask, then you must be a Democrat. If you don't wear a mask, then you're with the president. And it's a shame that people don't see this as a public health issue as much as it is. And then again, it's not everyone, but too many people.
Yeah.
But again, you also have to have that balance because some people have been affected health wise. I myself know people who have passed from this virus, and
Yeah.
I know people who have recovered from it. And I know a lot of people who lost their jobs. They're not going to be able to go back to work. So, what do you say to those individuals who are scared that in a month or two they did not get their stimulus check, or they did and it's gone already?
Yeah.
What do you say to them about living?
I say, look, I think it's too painful to go into another full lockdown. And I see that, and I've seen many people suffering. But, you have a choice. Do you want to do another lockdown, or do you want to wear a mask? Because if we wear masks and do some general safety things about distancing um, and avoiding indoor activities, we can actually slow the transmission down to containment levels. Containment being reproductive number of less than one. We know that we can. It's a simple choice. Do you want to go through the painful route, or do you want to do the reopening but wear masks? And masks, there's no such thing as carbon dioxide poisoning, as some misinformation of folks keep peddling. And it's inexpensive, and it's not permanent, it's not that invasive. We can do it. And ultimately, the thing is, I tell people, no one wants to go out to Jurassic Park and visit Jurassic Park if they know the velociraptors are roaming around the park. And, we're never going to get a full epidemic, we're never going to full economy back running again until we solve the epidemic. Consumer demand and everything follows epidemic elimination. As long as the epidemic is still floating out there, a lot of people are just not going to go outside. And so the number one root solution is to solve the epidemic, and we can only do that together. And so this is why, we have to come together on this. It's not a rugged individualism is not going to get us through this. So please encourage everyone. This should not be partisan. I honestly hope everyone sees that there is, a really good outcome that we can be had. And there's many countries that have done it successfully. So we know it's not impossible. We just need good leadership here.
A lot of people have talked about the different types of masks. There's some that are the cloth, you have the N95, the surgical masks. Do you find one better than the other? Do you encourage one, or do you just
So,
say just wear whatever you can get a
so
hold of?
there are different kinds of masks, and they do have different levels of protection. But the difference is that cloth masks, are incredibly effective in stopping your droplets. So my mask protects you, your mask protects me. Because your mask catches your droplets, my mask catches mine. And if everyone wears it, the number of droplets is actually very, very low. And we actually seen this where there was actually these hairstylists who gave 150 haircuts while having COVID and symptoms, but they wore a mask, and none of the hair clients, got sick. So
Okay.
that's amazing. So we know it works. So it's and then surgical, it's a little bit better, but surgical is not foolproof because there's leakage. The other uh, class is the N95, KN95s, and those actually provide personal protection, as in it filters out air that you breathe in as well. That's why doctors and nurses use them, but there's still shortages of the N95s, and the fear
Right.
is that we don't have enough. If everyone wears them, we don't have enough. And there is a solution for it. It's called Defense Production Act. We should have put that into place a long time ago, but somehow Trump is not invoking the Defense Production Act, and state can't do it, and Congress can't do it. It's only the president that can invoke the Defense Production Act for N95s. So again, another factor of leadership here. So long story short, it is solvable, and cloth masks are really good and effective as well. It just needs everyone to wear them, and that is the hard part, because if half the people don't wear them, half the people are still transmitting.
Right.
So this is to protect your neighbors, and just like JFK says, ask not what your country can do for you, ask what you can do for your country. And the ask is to wear your mask.
I'm going to ask you to put your political hat a little bit, because I'm sure you've seen in the news that the administration is pushing to stop federal funding for testing sites. In addition, they're also pushing to end Obamacare, which, as you know, over millions of people who lost their jobs due to this is now getting health care due to the
Yeah.
Affordable Care Act. So I'm actually at the point that I'm wondering if Donald Trump even wants to get reelected. Because at a time such as this, why would you eliminate funding for testing sites where these are people who might not be able to get tested any other way? Now, we all know he gets tested every day, but that's not the average American.
Yeah. It's extremely, extremely frustrating because people are literally dying. And by the way, it's this with this illness, it's not just death. There is a huge number of people who are suffering like kidney damage, blood clots, diabetes, heart disease. And actually, they actually showed a lot of people in critical care. In British, 6 out of 10 people are showing some sort of brain damage, including
Wow.
dementia and strokes. And that's just terrible. So it's not just death, by the way. So now, Affordable Care Act. Obviously, that's a very political thing, which they just want to gut Obamacare. It's a political vendetta, right? And they hate the way it's structured, socialism and all that nonsense right now. But in terms of it's defunding the federal testing sites, that makes no sense. They want states to take it over, because they want states to have more rights and control. But this requires national leadership at the top. There's again Defense Production Act. It's something that only Trump can invoke. Instead of invoking it for masks, he invoked it for meat packing factories, which again makes zero sense whatsoever. Um, and I want to just point out um, that in the end, we all suffer this together. It's not a Democrat or Republican thing. Oh, there's some Democrats who are mocking. It's like, well, let the Republicans not wear the mask; they will suffer themselves.
Right.
No, because we all are neighbors, and if a Republican person, conservative, gets sick, it puts me at risk, and we are all, it's not a zero sum game. We shouldn't play a zero sum political game with this virus. The virus does not care about politics, and in the end, the destruction of our community is the destruction of ourselves, and we need to put this together. And I don't know what Trump is doing, honestly. They are botched. They're basically ignoring it. And at minimum, state leaders should not be putting mandates that says locals, counties, and states may not put any mask wearing mandates. And they've done that in Nebraska. They've done that partially in Texas, which makes no sense. Why are you trying to prevent people, local city officials and county officials, from implementing these mask rules? That's just anti-public health. But yet it becomes like political football to seem macho to put in these rules where you may not put in any mask rule. And so, please listen to public health scientists. Fauci's been warning, if you reopen too soon, you're going to have an epidemic. And lo and behold, what has happened is exactly what he said.
Well, why don't you think our elected leaders are listening to Dr. Fauci? Now, to be fair, as elected official, you have to care about all of your constituencies, and some people are being hurt more from the economic side than they are the public health side. So they have to find that balance. But when it comes to something as simple as wearing a mask, as not gathering in large groups inside doors, there are a lot of small things that I'm hearing that we could do. Do you think some of it is just misinformation? Facebook and some of the other social media sites are getting a lot of flack for misinformation that is on their sites for not taking it down. Do you think that's playing a part?
Yeah, it is. It is definitely playing a part. There's, for example, the carbon dioxide and mask thing. I have no idea where that comes from. I think that's actually from some weird misinformation campaign, which we know are out there because Facebook and Twitter had to take down a lot of accounts recently. Like Twitter took down 170,000 bot and misinformation accounts. But in terms of governors, I think there is this tendency that you must pledge loyalty to Trump for some reason,
Right.
and they pledge this political fealty to Trump, whatever he does. But I'm seeing some signs that they're obviously backtracking. But right now, Greg Abbott, all he's done is we paused the reopening, and our bars and restaurants must pause what they're doing in terms of their activities. But that's not enough. They have not rescinded some of their bans against city and local counties from implementing mask rules. It's, again, I think in certain ways they feel like if they lose their base, and people are thinking about their base too much, that it will actually have negative consequences. When I think they're not reading tea leaves right. That this is, but people are actually very bipartisan on fighting the virus. Even the majority of Republicans, did not want to reopen whenever a lot of the government Republican leaders were trying to,
Mm-hmm.
and I've gained a lot of Twitter followers, but actually a large number of them are conservative because they just want to get news. They want to protect their families. That's the primal instinct, and I think a lot of our Republican colleagues have totally misjudged and misread the situation. I honestly, I would rather people survive than just to score more points. As much as there are a lot of videos out there trying to score points on Trump, I don't think that's very constructive. I would rather people just live and not destroy the economy along with it.
Well, another thing I heard is that the virus dies in warm weather. And that's another reason why people are being more taking more leeway, not
Right.
wearing masks. And I'm looking at the look on your face. But that's something that I've heard, that the virus dies in warm weather. So now that it's summer,
Mhm.
you're less likely to catch it. I read that on several sites online. Would you like to clarify that?
Yeah. Um, I would say the reason there is some evidence that warm weather kills. We know heat and humidity kills it, but the problem is that the main driver of the heat is that people will actually go outside when it's warm, and when you go outside, there's less risk. But the problem is once it gets super hot, and they've actually done some studies. Nate Silver actually did an analysis of when it gets super hot, it actually turns around. Then people want to go inside for the air conditioning, right? And most air conditioning in the U.S. do not have UV, far UV like disinfection for viruses. The HVAC system just doesn't have it. So if it gets too hot, people come inside, and then it's counterproductive. So it's kind of like Goldilocks. It's yes, the heat does kill it, and when you go outside, you have less risk. But if it's too hot, people come inside, and I think that's actually part of what we're seeing in Arizona. Arizona's heat waves actually making people stay indoors more, which is the dangerous part.
Do you see more leadership on the state and local level regarding this pandemic overall?
Yeah, I think the state and local level they're the ones who are more aggressive in putting in the mask ordinances. But again, sometimes the state governors are blocking them from doing that. Um, Kansas, actually, the Governor Kelly, Democrat, she actually tried to put in a lockdown, but then the Kansas legislature had were able to veto her, and so Kansas never fully locked down. It's incredibly frustrating. We just want to solve this, and there's resources. This pandemic is not like a small like local wildfire. It requires resources from the federal level, state level to support local leaders. So it's not like a school board issue or a road, traffic jam. Let's redesign the traffic lights here. This requires a response from top down leadership and coordination. And right now, we're just so fractured as a country and such poor leadership up top. And our leaders are so politically, you know, playing politically loyalty cards over taking care of the economy and the American people.
Do you know where we are with the vaccine? Now, obviously, everyone may not be able to take it due to their personal health issues. But do you see that as a way to really, I don't want to say get back to normal, but open up the way things used to be before this all
Yeah.
happened?
Vaccine will be our ultimate solution, but it will take probably to middle of 2021 before it's mass available. So, we are racing towards probably like a dozen or two potential vaccine candidates, and many of them are in large testing phases. For example, Oxford's vaccine is now started enrollment of 3,000 people in Brazil to test the Oxford vaccine. We will hopefully get answers of where we will have one by September, October, and we may have a couple million doses for healthcare workers by late fall. But the problem is, a couple million doses is not going to cut it. We're going to need billions of doses for the entire world. And that ramp up and that logistical rollout, it needs cold chains, it needs mass production to get to those billions. That will take an enormous amount of time. And so maybe early 2021 we can start getting it, but the vast majority of people, it's going to be into this time next year before we can readily get it available. And I do not want our kids to be out of school for another year.
Right.
It's, and not to mention businesses and whatnot. And it's, we're not just by ignoring this virus and trying to let it burn through, we're not only killing our elderly, we are also partly destroying the brain and psychological development of our kids, our next generation, because they're going to be out of school for a year and a half potentially. and that's something that you can't just make up, right? So I'm really worried. Like, if there's any one message to my conservative friends out there who are saying this is a hoax or it's not a big deal, it's overblown, it is it is very real. Just go to the hospitals. I think that in the South they see it. And secondly, do it for your kids, because schools are not going to open up easily until we have the epidemic uh, improved. And I think schools may open up anyways, to be honest, in some areas, just cause. And it will be dangerous for the community. So do it for our kids so we can go back to a normal life for our kids at the minimum.
We only have a couple minutes left, but I want to get into a little bit about the disparities that this pandemic has really just highlighted what we already know. That there are a lot of racial disparities within the healthcare system, even with groups that are getting this illness and dying from it. I mean, I can even say everyone I know that has passed from this has been African American, and most of the people I know who received it has been some type of racial minority
Yeah.
group as well. And even those of us who have health care don't always receive the testing and the treatment that
Mhm.
other groups receive.
Yeah.
So tell me how this has affected. Are we starting to get more data about the racial disparities
Yeah.
so we can try
The
to find
rate
solutions
the
to
racial
that moving
disparities
forward?
is very severe. It's not, and it's actually a function of a lot of racial problems that we've had in America for a while, quite a while. First of all, who are the frontline workers who are working in the hospital janitorial jobs and a lot of the grocery stores and a lot of municipal services that has to go on? It's oftentimes minorities who are doing them, right? Um, and it's these difficult jobs who, people work in meat packing plants. It's oftentimes Hispanics. And these people are being sacrificed, unfortunately, by our terrible management and policies. And also another key thing is, housing, or, who lives in denser housing, um, and, more people to a house. It's oftentimes minorities and immigrants. And of course, if you live in denser housing, you're more likely to catch it.
Right.
And in terms of also morbidity and mortality, one of the key drivers of the chance of you being hospitalized, ICU, or dying is, diabetes, heart disease, or untreated diabetes, heart disease, which are, again, all risk factors because of poverty, lack of access to healthcare, expensive insulin, which, again, it always hits minorities hardest. And this is what's so frustrating, because every single neglected healthcare problem and societal racial justice and inequality problem that America's always had is just being brought to the forefront by this epidemic. Whether it's chance of being infected on working in a more hazardous job like meat packing factories, or chance of dying or being hospitalized because of your risk factors and because the lack of doctors and care, all of this has roots in American um, income and racial inequality. And it's incredibly, incredibly sad to see.
Right, but we're not hearing a lot of solutions toward that. I
No,
mean,
we
we have the
haven't.
president, we have the president using racial slurs, even renaming the
Yeah,
virus
yeah,
with different slurs and whatnot.
yeah.
And the Republicans aren't even correcting them; they're just letting him say what he wants to say. But I don't see a lot of leadership on fixing these disparities.
Yeah, I know. And it's the stimulus programs have so far mostly gone to a lot of corporations,
Correct.
other than that one $1,200 check, which is late for a lot of people. Um, this these kind of solutions, where obviously some solutions require long-term solutions, but at the most fundamental level, stopping the epidemic, there are so many things we can do, from these distancing measures, not blocking mask wearing, for heaven's sake, implementing the mask rules, setting good examples for the masks, and putting the resources into, for example, Defense Production Act. All these can be solved. Personally, I would rather have like every frontline worker, whether it's first responders, emergency workers, grocery store clerks, meatpacking, have an N95 mask just like a healthcare worker. And that would actually protect a lot more minorities. But again, those are hard to find. We don't have enough. And of course, they're not affordable right now. They're so expensive and it's out of reach for most minorities. I don't even have an N95 mask. I only have a cheap KN95 mask because it's so hard to find the N95s.
I found one for my mother.
Yeah,
I made sure she had one.
it is so hard to get though, and you have
Yes.
to
Yeah.
disinfect them and you can't wash them. There's I can lament about so many dimensions. We're not even talking about Trump, NSA throwing away the pandemic playbook or anything like that. There's so many things we can do, and so many things we know we could do and could have done. That at some point right now, in the middle of this fog of war, we just need to do the sensible things, and that's mask wearing. It does not kill you, and if I told you that we have a drug tomorrow that can reduce your risk of being infected by 70%, everyone would go out and buy it. And if I told you that same thing costs you like literally $1 or less and does not cause debilitation and it's free otherwise, you would do it until I told you it's masks. And then, of course, oh, no mask, God forbid. And so we just need to get over that reality because the double standards of our political fraction around this is literally what is killing us.
Yes, you're correct. But thank you for joining us today. It's a pleasure, and hopefully everyone takes away from your interview is to wear a mask.
Yes, please, and stay safe.
You too. Thank you.
Thank you.
Thank you for joining us tonight. It's the 4th of July week, but as coronavirus cases continue to rise, the holiday will look very different than it has in the past. America's fall in global esteem is turning into an international horror show as the world watches the United States, a superpower, struggle to match the efforts of many poorer nations to get the coronavirus pandemic under control. 3.5 years ago, when President Donald Trump took the oath of office, he set the tone in his speech when he said, "We must protect our borders from the ravages of other countries, making our products, stealing our companies, and destroying our jobs." But yet today, it is other countries protecting themselves from us. As Europe starts to reopen for tourists, they are actually considering not allowing Americans to enter the European Union due to the increase of US cases. Currently, only 2 states are reporting a decline in new coronavirus cases, Connecticut and Rhode Island. A rise was reported in a staggering 36 states. As the United States continues to break records on the number of cases reported in a single day, the US Centers for Disease Control and Prevention suggests that the total number of coronavirus infections across the US could actually be 6 to 24 times greater than reported. Officials in parts of the US are now trying to reel in the spread of the virus, which many experts have said is spiraling out of control. They are making pleas to the country's young population to keep their distance, urging the use of face masks and halting the reopening plans. The US has now hit over 2.5 million infections and over 125,000 people have died from this horrible virus. This is according to Johns Hopkins University. There are at least 254 treatments and 172 vaccines currently in development to fight COVID-19. If 95% of Americans wore masks today, the University of Washington Health Institute projects that 33,000 fewer people would die by October 1st. As imperfect projections may be, a swelling body of research agrees that masks would significantly reduce the spread of infection. If you take anything from tonight's discussion, please remember these three crucial points. One, wear a mask. It not only protects yourself, but it protects others. Remember, this is a short term inconvenience for a long term gain. Two, practice social distancing, especially from those who are not wearing masks when out in public. And three, practice good hygiene. Wash your hands. Cover your mouth when you cough and sneeze. These are all things we should do anyways, but it is imperative now to stop the spread of this deadly virus. Unfortunately, not all of our elected officials are taking the lead on this issue, so we must take the lead and be the examples for them. Please subscribe to watch our weekly show on YouTube at Rogette Harris, and feel free to send a comment, show idea, or just say hi to unfinishedbusiness at rogette.com. Again, thank you for joining us tonight. Be safe and join us next Wednesday at 7 p.m. Let's get busy and solve some unfinished business.